The pH secret nobody talks about is the 7.4 principle. Your hormones, your energy, your immune system, your ability to recover from anything, they all depend on the number staying stable inside your body. And your body will pull calcium from the bones, push your kidneys to the limit, and drain every internal reserve it has to protect that number, that 7.4. Because the moment it shifts, your hormones stop working properly, your energy drops, and your body loses its ability to repair itself. That number is 7.4. Today we explain what threatens every single day and why your doctor will never see it on a standard blood test. Welcome to another episode of the RESPIRA Series. My name is Dr. Carlos Torres. I'm a specialist in otolaryngology, sleep medicine, and obesity medicine. And today I'm here with Dr. Diego Rutenberg, a specialist in functional medicine. So welcome, Diego, to another episode of the RESPIRA Series.
Thank you.
So in the last episode, we spoke about the importance of the pH. We introduced the concept of pH and why it was important, how in patients that were sick, we would see significant shift in this pH, but how in normal people, it's hard to detect that pH, out of balance, and how our body is constantly compensating for that. Some of those mechanisms of compensation ultimately might lead to some chronic changes, that might end up us in not having an optimal state of health. So I think that today, it is important that we go and start introducing some of the things that physiologically allow us to stay within a normal 7.4 pH balance, which is the number that our body is constantly targeting. That acid-base balance, that pH number needs to be at that 7.4. And what can we do to help our body and to prevent it from constantly being in a state of compensation? Okay, so let's talk about the first four pillars and the four pillars that we have identified. One of them being sleep, and why you think that sleep is important.
Well, sleep is the restoration, the rest and digest, and repair system, and we are 1/3 of our life asleep, and our body requires the deep sleep and the REM sleep for brain restoration, for physiological restoration, and I guess that's also the starter of the conversation, at least in my practice.
Yeah, no, absolutely. People see sleep in a very simplistic way, where you go to sleep to feel rested, but what we are missing is all the details of everything that happens while we're asleep in our body that are repair mechanisms. Not only, that if those repair mechanisms are not working properly, we might sleep for 7-8 hours and still wake up feeling tired, right? So
that's a very common
and it's
comment. Yes,
extremely common that we see a lot of patients that they feel that they sleep well, they sleep for a good amount of time every night, and they still constantly tired. So definitely there's some aspects of sleep that we don't take into consideration, that are extremely important at the time of managing and trying to optimize sleep in order to allow sleep to become an element of restoration and to allow all those normal physiological processes that help us feel more energized, to happen the way that it's supposed to be. The other element of that we mention is breathing, that is directly connected to sleep as well, and particularly the optimization of nasal breathing. We see a lot of people in the other episode. You talk about how in the old days people used to work, outside and more physical work, and how breathing properly became such an important part, in their performance, right? And that these days we have lost that ability because we don't have the same demands. And probably that has led us to, develop abnormal breathing mechanisms that also have an impact on our pH to some degree.
I was puzzled many years ago in the kind of many times patients bring you solutions before you actually seek them. You know? And I remember it was probably more than 10 years ago when one of my patients brought a sleep tape. You know, and it's like, yes, I saw this online and I bought it, meaning that many people sleep with their mouth open, and people started doing that, aided by a tape, Of course, that triggered myself investigating that, but that's fascinating how people, the sleeping with the mouth open, makes the restoration less effective.
Absolutely. And what is a little bit counterintuitive in terms of the breathing is that when we are more worried, we hear about the alkaline diet and everything towards being more alkaline, trying to avoid an acid state, okay? Most people that have an abnormal breathing mechanism, they actually have lower levels of carbon dioxide because either they are breathing too fast, which we call hyperventilation, and that state of breathing, actually affects them because carbon dioxide is also a very important aspect of normal physiological function.
You know that a tool that everybody has and the usually primary care physicians create right away and many times a year is just a conventional blood test. And people come to see us and telling us that their blood test is all normal, but they are feeling bad. And when you identify and you start understanding the electrolytes in a conventional test, and you put them all together and you see the correlation between 2, 3, or 4 years or 10 years back of electrolyte evolution, and you can see that the change, usually carbon dioxide goes down. But that is a marker that usually is ignored as a diagnosis. So what you're actually saying makes sense, but how to proceed once you understand that the carbon dioxide is lower in reference to the other electrolytes.
Absolutely. It's that we have lost the ability to tolerate higher levels of carbon dioxide. Carbon dioxide is what drives our respiration, okay? And when there's no need, we are in a state where we don't tolerate those higher levels. We don't need those higher levels. Why? Because carbon dioxide, for example, in the case of oxygen delivery, is what allows oxygen to be released from hemoglobin so that it can really, go into the organs and then carry this function of energy. So again, even though we are focused on acid base and trying to reduce acidity and maintain a normal 7.4, we understand that is more of a systemic physiological process. And what we're trying to do is, what are the different aspects that might have an impact or might lead to changes at a metabolic level that affect, lead our body to be in a constant state of compensation.
So you were talking about sleep and
the breathing. And then the next one is nutrition. So again, how you feel that nutrition has an impact, and we all hear about nutrition, and that nutrition is the best medicine, the right nutrition. But what impact does nutrition have on an acid-base balance in the body?
Well, the lack of vegetables, the lack of fresh food in people's diet, diminishes their vitality. We do testing on nutrients. We can do an organic acid testing on nutrients, and we find a great big of deficiencies in vitamins and minerals in general. And when we try to restore that through optimal nutrition, we usually see an improvement in long-term outcomes.
No, and I think especially in this age where we are so focused on high protein diets, one of the things that is the main drivers of acidity is protein. And we are so focused on losing weight through a low carb.
I've done high protein. I've done a few times carnivore diets.
Yeah. And again, this is not a one size fits all. There are people that benefit. The idea is not to put people in the same box. Okay. There are people that might do very well with that, but when we're seeing somebody that is presenting what we're discussing, leading a relatively normal, healthy life and still very symptomatic, this might be one of the things that we need to start looking at, your diet.
As an athlete myself, I was a triathlete. I was running triathlons, long distance triathlons. And because of the ways of what you decide to do, I went into a complete vegetarian diet.
Yeah.
And I was feeling great. But at the same time, my levels of energy and the output of my racing was actually coming down.
Yeah.
So, and I found that a balance was the ideal, but vegetables are certainly something that we need in our diet to balance the pH.
And to balance the pH. And for example, going back to sleep, we hear a lot of people that take magnesium constantly, and other supplements to help them sleep, and that actually helps them. Maybe, by taking that supplementation, they are replenishing some of the deficits that they're not getting through their diet, which take us to our fourth pillar, which is the supplementation, right? In the case of magnesium, going back to magnesium, we know that magnesium is one of the most alkalizing agents that exist, so it is very important that we supplement that well for different processes that happen in our body. But because of the lives that we live, the amount of processed foods that we eat, the sedentary lives that we live, that we carry every day, the supplementation becomes an important part. How do you use supplementation in your practice?
We always assess the general state of the case, and the supplementation is only when we see in the data that these elements are missing. So if we can extrapolate from conventional biochemistry a very extensive and I would say quite accurate state of nutrition. A conventional blood test analyzed in a different way would give you information about what are the tendencies of the body in terms of nutrients that they are missing.
Yeah.
But and usually it depends on the gravity of the case. If you have to do a very quick intervention because the quality of life is very poor, probably you would jump into a supplementation process.
Okay.
If not, you order specific testings for specific nutrients that they might be deficient. But I mean, I've been in practice many years, almost 16 years, and I see that most of the people's, for example, you were talking about magnesium. Most of people, magnesium is depleted.
As things as simple as vitamin D,
yes,
which is just to just spend you get
vitamin
the sun.
D is also mostly deficient.
Yeah,
and in reference to the acid base balance, we see fluctuations, big fluctuations, and there are patterns of these fluctuations that they match the patterns of symptoms. So, it becomes almost like an intuitive approach when you see the biochemistry. But the supplementation has a big role. Let me tell you one thing. When I was in the 80s, I was in college in Argentina, and I used to protest against supplementation companies.
Okay.
Yeah. You're a college.
You're a rebel.
You're a rebel, and you're saying we don't need that. But at that time, nutrition was different.
Yeah.
Soils were not depleted, and we argued that people needed really food on their dinner tables or on their tables. Now I think things have changed, and the industrialization of the food complex is requiring many people who come to see us with a baseline supplementation.
And I mean, and it's not only from the nutrition of foods, but also even in the water. The quality of the water and the minerals in the water, that you would normally we would take, from just drinking water, are missing. So even though we might be having a healthy nutrition and drinking lots of water, if that quality of that water is not good enough, we're not getting the nutrients that we need, and that's where the supplementation becomes important.
And you see the face of a patient who is looking at the lab, and I'm saying, but I'm eating right, and my levels are low. So that's one supplementation comes very important.
Well, in the next following chapters, episodes of this series, we're going to talk about each one of these pillars in detail and offer solutions and recommendations in order to optimize your sleep, your nasal breathing, your nutrition, and how to supplement properly.
I'm looking forward to it.
Pleasure to see you again, Dieguito.